My name is Josh George. A little about me: I'm from Hollister, California. I just graduated Cal Poly San Luis Obispo with a degree in kinesiology and an emphasis in exercise science. Played 4 years on the Division I baseball team and learned a lot and had great experiences out there. And now I will be applying to grad school in winter for orthotics and prosthetics. And so, prosthetics deals a lot with the psychology part during treatment and rehabilitation, and so that's one of the reasons why I'm taking this class. Is it's a prereq for those grad schools, and it leads right into my project. So I'm doing my project on phantom limb pain, and why is because the future profession and career that I'm going to be going into, and it's common in a lot of people with an amputation, and psychology plays an important role in the reason for and treatment of PLP. And so what is phantom limb pain? Phantom limb pain is the pain you feel in the limb that is no longer there after the amputation. And so during the amputation, peripheral nerves are severed, and this causes massive tissue and neuronal injury, causing disruption of the normal pattern of afferent nerves and input to the spinal cord. And so, a lot of people experience this, and it's a bummer because they can't do anything about it. They have this pain in this limb that is no longer there, and the only way to get rid of it is usually to move it, right? And they feel this pain of like a knife going in your hand, or someone running it over, or someone hitting it with a hammer, or even an itch, annoying itch, and there's nothing to do about it. And so there's a lot of problems in it, and right here, 90% of amputees experience PLP, and luckily only 10% of those are chronic. The other 80% are up to like 2 months to 2 years of total PLP, and a lot of that is delayed because people believe that if they tell their doctor about PLP, the doctor will think they're crazy. And it used to be thought as a psychiatric illness, and so a lot of people are reluctant to telling their doctor about this injury because they think their doctor might think they're crazy. And so some theories behind PLP is, the main one that I read about was neurologist Jack So, and he talked about the exteroceptive sensation, and those are sensations such as touch, pressure, temperature, and itch. And so there's a multifactorial approach, so many factors are leading into this approach, and it's proprioceptive memory, so it refers to where the limb is positioned and the sensations you feel. And so he thought of it as in steps. So the first step would be residual limb neuromas, and that's just the growth of nerve tissue at the end of the limb. And then remapping. Remapping is kind of when they place neurons in specific areas for sensory reasons on muscles. So later in the prosthetic, when they do get a prosthetic, they'll be able to contract the prosthetic using their muscles. And those are, high-end prosthetic or prosthesis. And so next step would be monitoring of corollary discharge from motor commands to limb. And so a lot of people, when, let's say you're just hanging your arm down and that residual limb starts building up with fluids like blood and stuff like that, and they got to control those fluids so that the muscle doesn't, or so that limb doesn't swell up and they can't fit their prosthesis on. That, and then internal body image, so what you perceive your arm to be that is no longer there, and vivid somatic memories of painful sensations or posture of the original limb. And so, Dr. Sow and his colleagues proposed that proprioceptive memories remain in an individual even after a limb has been amputated. And so the brain mechanisms that sense proprioception remain intact. And so there's still this memory of, your limb being there, in all these positions, and it may be reactivated. And that's what, is the main reason causing this phantom limb pain. And so there's multiple types of treatment. We have medicine, some opioids, antidepressants, and surgical. You could do nerve block. You could do the stump revision, where they go in there and just try to clean it up a little bit. And you could do some CNS stimulation. Um, a big reason for antidepressants is because so many people get stressed out and depressed from having this amputation, even before when it happens, because they know they're going to have to get it. And so it only lasts a couple years, which is nice. So they really only recommend taking antidepressants for a couple months. And then people usually learn to just accept the fact that they no longer have that limb. And so this is, more of what I'll be studying is the non-pharmacological therapies. And so we'll talk about TENS and we'll talk about mirror therapy, but there's also ultrasound, hypnosis, and virtual reality, which is pretty cool. Because let's say someone has a double leg amputation, they can't even walk. They'll put on this virtual reality and, imagine people walking, and that will just relieve PLP, which is, amazing to me. And so that's just some cool stuff that you could do with treatments. We'll go to the next slide here. And so TENS is electrical nerve stimulation that has been found to be helpful in PLP, and it's easy, it's portable. It's kind of like, when you trying to get a stimulated muscle with those electric pads, it's kind of the same thing as that. It's portable, it's pretty cheap, and so that's one effective way to relieve PLP. And mirror therapy is one of the biggest things I think that you could do for phantom limb pain. And so, it's the most consistent used type of therapy today. And, so Dr. Sal ran an experiment for, I think, 4 weeks, and he learned that all of the patients that he did where they used mirror therapy reduced their phantom limb pain. And so he ran the experiment with a placebo too, and none of them had reduced any pain in there. And so after 4 weeks, a significant amount of pain was reduced from this experiment. So that just tells you how well this therapy works. And it's the visual pathway that helps modulate pain in some manner, which is really cool from a psychology point. And so pretty much what it is that the patient watches the reflection of their intact limbs moving in a mirror placed parasagittal between their arms and legs, while simultaneously moving their leg or arm that they have in like kind of the same way that they move their other leg. And so you're watching this mirror and you're looking at your right leg move, but it's also the mirror's on your left, right? And so you can imagine moving both your ankles in like a flex position, and that relieves pain, which is crazy to me, because just all the stuff that goes through your brain and back out, and just the psychology part of it is just so fascinating. Reasons. One thing that's cool that I'm doing right now is I'm doing an internship with a prosthetist who's someone who's named for working with prosthetics. And I asked him about phantom limb pain, and he said he hasn't really dealt with a lot of people who have had chronic phantom limb pain, which is really cool. He says he thinks the best therapy is mirror therapy, which is what they do, and what I'll be learning. And I told him about the virtual reality part, and he said that was awesome. He wishes he could get his hands on it, but it's pretty expensive and stuff like that. And so I've just learned a lot from that, and kind of the psychology part of how to deal with patients who are depressed or against learning new ways to better their prosthetic skills, I guess you could say, and all about the rehab part of it. And so it's just been a truly amazing experience, and I'm looking forward to diving into this a little bit more. And so I hope you enjoy this presentation, and thanks for listening.